welcome all of you today as we come together and discuss a very significant award from New York State for the purpose of providing care to our patients who have substance abuse and addiction. We formally accept this award. It's $825,000 from the New York State Healthcare Facility Transformation Program to expand our Clearview Treatment Services Program. It's important for Mount St. Mary's because it allows us to expand Clearview from 22 inpatient beds to a total of 30 beds and care for those fighting various drug, chemical, and alcohol addictions. We've been providing this service here at Mount St. Mary's since 1986. And for 31 years, we've been helping people and I think saving lives. The need for our services at Clearview is well documented. If you just look at the waiting list, which averages 10 to 14 patients a day, and this is not a service people can wait for. They go off the waiting list because they go back into their old habits. But today offers good news. Construction is underway right now on the 4th floor of the hospital as we transform this unit to accommodate 30 patients and opening these additional beds. It's just a few short weeks away.
I'm the chair of the Mental Health Committee, and I've been a member and a co-chair of the Heroin Task Force since I got into the Senate. And one thing you realize is there is a huge overlap between folks struggling with addiction, particularly heroin and opiates, and mental health. In many cases, it's not just an addiction crisis we're facing, it is a mental health crisis that we're facing. And those two cannot be separated. You have to really treat both. And that's why I think it is important that Office of Mental Health has been involved with this, OASIS has been involved with this. And this funding was approved, of course, as part of the state budget by myself and my colleague in the Assembly, Assemblyman Morinello. And I think it shows there's a real commitment financially from New York State to battle this crisis. This is going to increase from 22 to 30 beds. Now, 8 additional beds might not sound like a lot, and it probably isn't even enough. But the reality is that's 8 individuals whose lives can now be saved. It's 8 families who will get the help that they need and their loved one will be able to get.
I was fortunate enough in my 14 years on the city court bench to have been set what I call second chair to drug crime. Clearview was really and truly one of the foundations for that program. Clearview combines physical as well as emotional and mental support to assist those who are fighting addiction, whether it's opiate, whether it's heroin, whether it's alcohol.
By the time you come to Clearview, you're pretty sick. Most of the people that come to us are in treatment in other facilities but are not able to maintain sobriety. We are the highest level of care that OASIS offers. From top to bottom, ceilings to floors, paint, new bathroom fixtures, new beds, furniture. It's going to be gorgeous.